Welcome. Thank you for joining us virtually for a press briefing. My name is Kelly Chandler. I'm the Public Health Division Manager for Itasca County. Itasca County has been hosting press briefings to highlight themes emerging in our community related to COVID-19 or frequently asked questions posed by our community members. We are providing weekly written updates for the media. Today, we will continue our discussions related to local school districts and the supports they will be providing to parents and families to safely return to the buildings in the fall. We will discuss what to expect in classrooms, how to access mental health, and what to observe for in children experiencing stress, masking protocols and some exclusions for schools related to illness and the importance of routine vaccinations, and most importantly, how parents can positively support their children. Our panelists today include Annie Olson-Reiners, principal from Keewatin Elementary, Nate Elson, counselor at Grand Rapids High School, Kelly Payne, registered school nurse, Greenway Public Schools, and Dr. Dan Suhler, vice president of medical affairs and family medicine physician, Grand Itasca Clinic and Hospital. One frequently asked question related to our schools is in regards to wearing masks. Masks are required in schools with very few exceptions, such as when students are eating or drinking, engaging in activities requiring exertion, such as gym or phy-ed, or if needing to visualize the mouth for learning purposes. This is important to prevent the spread of COVID-19, which is transmitted via respiratory droplets when someone is talking, singing, coughing, or sneezing. To be most effective for protection, we need everyone following this guidance, including students and staff. We certainly hear questions on exemptions, and really, there are very few medical reasons why someone couldn't wear a mask. Our local health care providers agree that someone with a chronic breathing condition could experience more harmful effects from COVID-19. Thus, an exemption would not be warranted in that scenario. Exemptions that would be considered very likely are already known about by our local districts as far as a disability or a severe behavioral health condition. We are relying on parents and caregivers to speak positively about masks to our children and remind them all schools in Itasca are following the same process. We're all in this together to keep them safe and in school. For our situational update, 154 Itasca County residents have tested positive for COVID-19, and we remain at 12 deaths. Our most recent death was 2 months ago in early June. The positive case age ranges are 6 months to 94 years. Our cases are mostly community spread from both known and unknown sources. We know that our local COVID-19 case numbers will inform decisions made by local school districts on their learning models, whether that be in person, hybrid, or full distance learning. Districts will be looking at the previous 14-day case rate per 10,000 people in Itasca and using this to guide their planning. Our rates can be found on the Itasca County Public Health Facebook page or on the Itasca County website in the COVID-19 section within our situational updates. Our 14-day case rate per 10,000 has been steadily decreasing in August. Let's keep it up to keep our school children and our teachers safe. Now more than ever, we need each of us together to slow the spread of COVID-19. Wear masks, refrain from congregating in groups, social distance, and stay home when you're sick. I will now as principal at Keewatin Elementary.
Hi, Kelly. Thanks so much. That is so true. We are really excited to have our kids back at school, and we are relying on our community to help us make that so. So thank you so much, everyone who is helping to keep our kids safe and our staff safe. I get to talk about some of the most exciting things, which is welcoming kids back to school. I love children, obviously. We all do. We go into education because we love this. And I want to share some of those classroom expectations that parents can expect here when their children come back to school. I also want to make sure that I am lifting up all of the efforts of our local principals who are phenomenal and working so hard. And we are really going to benefit from your grace and your honesty this year. Those are two really important ingredients for a successful year together. So I want to give you quickly where you can find information for each district. So in IASC, we have many different districts within us. And if you're a Nashwauk Keewatin family, you can find information at our COVID-19 updates tab right on our main webpage. If you are in Floodwood, that is also true. you can go straight to their website, and all of the information and updated information is in their news and live feed. For Floodwood, excuse me, I just said Floodwood. For Hill City, they have a COVID-19 updates tab right on their website. For Deer River, it's right at their main page, and the most recent plan, the Warrior Back to School plan, is right there, right when you navigate to their main webpage. For Grand Rapids, they also have a COVID-19 tab on their main website. In Greenway, information should be communicated via their parent square, and it's also available on their website. In Northland Community Schools, they have on their main webpage a return to school safe learning plan. And if you have questions, please call the principals in the buildings where your children attend school. We will work really diligently to get back to you as fast as we can. There are many moving pieces here, many challenges, and many things to be excited about too. So I want to quickly just go over, yes, all kids are gonna wear masks, and how we set the tone for that will be how children are going to go into school and live their lives this year. So we need you to have all the excitement of an NFL cheerleader to say, oh, you're going to wear a mask at school? Awesome. Let's pick out masks that are going to make you feel excited and cool at school. So if you like turtles, let's find you a turtle mask. Additionally, yes, we will be spacing children out. Oh, wow, that's fun. So you'll be able to practice that at home, like put your arms out, spin a circle. Awesome. Remember to do that when you're at school too. It'll be good that we've practiced. Oh, you're going to eat lunch in your classroom today? Awesome. That's like a lunch club. That's so cool. Maybe you'll get to sit, by one of your friends that's a new friend for you this year. Your attitude and the tone that you set for your kids is going to be what makes or breaks a year with in school and with us. And we will continue to support you and answer your questions and do everything that we can to support safety and everybody here back at school. And then I also want to talk a little bit about mask practice. So parents, you've taught your children what has seemed like impossible things over and over in your lives. You've taught them how to sleep by themselves. You've taught them how to go to the bathroom by themselves. You've taught them how to tie their shoes. You've taught them their manners. You've taught them so many things. And wearing a mask is another thing that you can help us teach. So making sure that right now, if you haven't started already, to practice wearing that mask for short periods of time each day. I am not above M&Ms and Skittles in my house, so if we can make it half hour with a mask, then here's a Skittle. Or maybe it's a cherry or a piece of fruit or something that they're really looking forward to. But you've taught them so many things already. You can do this too. Something that's really kept me anchored this year is a quote from Eleanor Roosevelt, which is, "We must do the things we think we cannot do. This we can do." We're so excited to welcome kids back. And the two main ingredients again for this year will be honesty and grace. Thank you so much, everyone. And thank you, Itasca County Public Health. We're all truly in this together, and we can't wait to have them back.
Thank you, Annie. We will now welcome Nate Elson, counselor at Grand Rapids High School.
Thanks, Kelly. I'm Nate Elson. I'm one of the counselors 318 at Grand Rapids High School. Managing a higher amount of stress and complexity of stressful situations has become our new norm in our community, and especially for our students. Identifying systems of stress can be different for every child based on age and experience. For younger children, it might look like stomach aches, bedwetting, nightmares, nail biting, and older avoidance or pattern changes are more prominent. However, since many of these symptoms are based solely on the individual, we're looking for more noticeable change from your student's norm, more so than those specific indicators, such as a change in behavior, a change in mood, a change in process, or frequency of that behavior, increased stomach aches, more prevalent nightmares, eating more, sleeping less, changes in mood or social patterns that tend to be warning signs of stress. Also, as we know, stress and anxiety impact the brain, and many students under stress struggle more readily with concentration, following directions, and memory retrieval, which we see all the time. One of the most clear-cut ways to identify stress within your child is to rely upon what you know about your child already. Know or ask them, what are your triggers? What sets them off? What do they do when they feel or when they demonstrate stress? And be observant of those changes when they're present. Step you more away when they're dealing with stress management. When considering how to better manage stress for our students, the first key again is going to be awareness. Being aware of your child and their response in both stressful times and times that aren't stressful can help you identify what their normal is. Consider setting up a specific time to check in with her or him and talk about those expectations, those feelings, the worries, the deadlines, and just how things are going at school. Take advantage of time in the car or around the dinner table and help your student figure out who they are and how they deal with stress. Secondly is controlling what you can. Whether your student is going to be online or in person this fall, setting up expectations around a distraction-free workplace and sharing a schedule, a study schedule specifically, and including downtime within that schedule can help your students stay on track and balance priorities more effectively, as well as help your child stay more accountable. Encourage your student to find the balance. Families. When it comes to helping your child manage stress, help them create a plan. Encourage your student to identify what activities, experiences, or interactions allow them to feel more stress. Have your student identify how she or he feels stress in their body. Work with your student to commit to coping skills when and before stress is even felt. And also help your student identify how they would like you to respond to them when you notice those warning signs. And similarly, how they would like another adult, maybe at a school setting, to approach them if they notice those warning signs that they've identified. And lastly, taking care of ourselves is just as important for adults. If we're maxed, we will not be able to help those around us. If we're demonstrating appropriate skills, it's more likely that students will as well. With that said, that does not mean that adults will not struggle. Showing our students how to deal with difficult times is very important. Calmly letting them know that you need to take or tough decisions, follow from the steps that you would expect your student or your child to take are great ways to model those skills. And the biggest struggle for most of us is knowing the awareness and having our own limits in mind. Take time to make a similar plan for yourself and share that with somebody else. Lastly, know that it's okay to do your best with the given situation that we all have. Do the things that you'd want your student to follow through on. Be proactive, make a plan, ask for help, and communicate. Part of being an effective role model is really following through on the same things that we'd expect for all of our students. Thank you. Good luck.
Thank you, Nate. And now we will introduce Kelly Payne, registered school nurse, Greenway Public Schools.
Thanks, Kelly. I am Kelly Payne, and I am, excuse me, I'm the district nurse for Greenway Public Schools. I'm going to touch on a couple things that pertain to the health of our students. Just remember, this is the tip of the iceberg. There is lots of information coming from both the Department of Education and the Department of Health that all districts have to follow. But most importantly, it's important to recognize when your child may have symptoms associated with COVID-19. The symptoms associated with COVID-19 include a new onset cough or shortness of breath, or at least two of the following, which can include fever, 100.4 degrees or higher, chills, muscle pains, sore throat, fatigue, congestion, loss of sense of smell or taste, or less commonly, GI symptoms, including diarrhea, vomiting, or nausea. These symptoms may appear 2 to 14 days after your child was exposed to the virus. Not everyone with COVID-19 has all of these symptoms, and some people may not have any symptoms. It's important that if you recognize any of these symptoms in your children, that you keep them home from school and you give your school a call. You know your children best, and so please, if you recognize any of these symptoms, do not send them to school. The amount of time at home depends on a few scenarios. I won't go into all of them, but all school districts must follow an exclusion chart given to them by the Department of Health. They are not excluding on an X number of days based on how they feel, they are given this guidance from the state and are required to follow it. Most times your child will be excluded from school for a minimum of 10 days. After those 10 days, they may return to school once they have been fever-free for 24 hours without the use of any fever-reducing medications. If your child has siblings in school, they will also be excluded from school for 14 days. Although they may not be showing symptoms, they could develop symptoms as late as on the 12th, 13th, or 14th day. That is why they are required to stay home from school for those 14 days. Excuse me. Those times that children are staying home and may feel well are times that distance learning will most likely be indicated. So they are not completely absent from school. They will still have the opportunity to distance learn. Your school will work closely with you when your child is sick. We also rely on parents to monitor your children closely, and now is definitely not the time to throw caution to the wind. Your child will be sent home from school if they exhibit any symptoms that are associated with COVID-19, as previously listed. Your child will wait in a supervised room that is quote unquote an isolation room, although it will be supervised with spacing so that if there are other kids in the room with them, they'll be at least 6 feet apart. They will wait in this room until there is someone at the school to pick them up. And then just to touch on a few other things. So like Kelly said, all students, staff, and other people present in school buildings and district offices or riding school transportation vehicles are required to wear a face covering. Face coverings are meant to protect other people in case the wearer does not know that they are infected. Schools are doing a variety of things to keep children safe at school. Some of these things include providing social distancing in common areas, the use of the face coverings by all students, staff, and other people present. We'll build routines of hand hygiene into the daily school schedule for both students and staff. And schools may potentially use barriers like plexiglass shields in common areas and in classrooms, and increased disinfection practices in common areas and classrooms. That's just a tidbit of what schools are doing to keep your child or children safe. Their safety, health and safety is the #1 priority for schools at this time. Please keep your child's schedule well, child visit or physical. It is so important that they get their required vaccines for school. We do not need an outbreak of pertussis or measles on top of COVID-19. It is also important that they get their flu shot this fall. You know, the flu shot can help reduce the risk of flu-associated hospitalizations in children and can prevent them just from getting sick with the flu. Please, please, please keep the regular doctor's appointments and immunization appointments. It is very crucial at this time that they stay healthy. I'm very, very excited to see students back in the fall, and we will be relying on parents, guardians, and caregivers to help us keep our students and staff safe. And just to reiterate what Annie said about honesty and grace, please give that to your health services offices because they will need it this fall. Thank you.
Thank you, Kelly. And we will now hear from Dr. Dan Suler, Vice President of Medical Affairs and Family Medicine Physician, Grand Itasca Clinic and Hospital.
Hi, Kelly. Thanks for having me on this panel. I echo everything that's been said by our previous panelists. I couldn't agree with what has been said more. Certainly, this is a great time to teach our children and reinforce everyday preventative actions. As we mentioned before, practice wearing that mask now. The first time your child wears a mask should not be the first day of school. So practice wearing it for 30, 60 minutes at a time. and increasing that over the next couple of weeks prior to school starting, I think is going to be huge. This is a great time to reinforce the importance of washing hands, and for the full 20 seconds, saying happy birthday to yourself a couple of times. Again, just reinforcing that common practice, and then practicing social distancing, whether it's at home, if you're having play dates outside, or participating in various activities that are going on right now. Practicing all of these efforts previous to school can really make that first week of school go a little bit better. As always, we always encourage kids to stay active. 60 minutes a day is what we encourage, both before school and during school days. Staying socially connected, as Nate previously mentioned, that's so important. For the last 6 months, a lot of us have been isolated, and that includes kids. And so utilizing technology as best as possible so that kids can stay connected to each other is so important to keep that mental health, as healthy as possible. Sleep, this is again another good time to reinforce the idea of the importance of sleep, keeping kids on normal schedules both Monday through Friday and on the weekends. We know 10 hours of sleep is ideal. There's been studies that show that helps with school performance. So just reinforcing the importance of sleep. As previously mentioned, parents know their kids best, and when in doubt, if your kids, are coming down with physical symptoms or some behavioral changes, really have that conversation with your children. If kids are getting the symptoms that Kelly mentioned previously, that's well known for COVID, we're ready to see your kiddos in clinic, whether it's virtual visits to have that discussion over the phone. Is my child coming down with symptoms of COVID, or could it be something else that we know kids get, especially during the fall and winter, strep throat, earaches, and whatnot. So we're ready for your kids and for those conversations. And then finally, I want to touch again on vaccinations. We know both at Grand Itasca and throughout the state of Minnesota, vaccination rates have declined over the last 6 months, as expected. Kids just aren't coming in to the clinic as frequently as previous and on their regularly scheduled visits. So whether it's a well child exam, a sports physical, we want to prevent what we can. Right now, we don't have a vaccination for COVID. Hopefully, that will be coming down the pike, but we don't know when that will occur. So let's protect ourselves against flu and all the other childhood illnesses that we can through vaccines. And again, I just want to thank the schools. I think we have a great collaboration with them going forward, and I think I'm very positive that the schools are prepared to take care of our kids as safe as possible going into this fall. Thanks, Kelly.
Thank you. And we will move into the question and answer portion of our press briefing. We ask that the media submit questions via the chat, and it will be answered by our panelists. And we also are joined by Jean McDonald, President and CEO of Grand Itasca Clinic and Hospital, and Angela Cleffman, Chief Operating Officer of Big Fork Valley. We do have our first question, and it is from Greg Grell. To any of the school officials, what would be your most important advice to parents whose child might be worried about returning to the classroom this fall? I don't know if Annie or Nate would like to respond to that.
I know Nate will probably be able to add for sure, but I think in general, being a little anxious about returning to school, especially if you have really been careful this summer, is normal and natural, and children feel all of the things that adults feel. So validating their fears, listening to the things that they're worried about will be really important. And know too that a lot of the principals in IASC have children in our schools too. So we're making decisions to help mitigate risks wherever we can. And most of us feel like we really are parents when you aren't there with them. So know that we will take care of them and make all the best choices that we can. So please reassure them of that, just like Dr. Suhler said. But also, I think one of the things that my mom always told me when I went off to camp and was nervous, would I have friends? Would things be different? Where would I be? Where would I eat? All of those things. Encourage them to dig in and be busy. and to trust their teacher and to follow directions, because those teachers are going to do everything and more that we've asked of them, and they're in phenomenal hands. So affirm their fears, reassure them, and then encourage them to continue to communicate with their teachers, with the adults who care about them at school, and with you, because it's going to be teamwork here to make sure that we're keeping all of our kids safe. But I'm sure, Nate, you probably have something to add that I've missed.
Well, and that was very well said. I think validation is the most important, and just making sure, I think communication is that big piece, and just really sitting down with your child and talking through those things that they're worried about and really coming up with a plan to address those. That's really one of the best ways to deal with stress, is to be honest about it, to give them the information they need and help them make the decision that they can certainly make, because a lot of that is going to come back full circle at some other point when they're going to have to make difficult decisions. So I think a lot of it also is sharing some of the things as a parent that you might feel worried about, and sharing that with them so you can kind of model that for them and work through how you deal with stress and how you worry about, we're going to be in the classroom, what are we going to do, what do I expect, kind of talk that through, how you would process that so they can learn that skill of processing that for themselves, and maybe who at the school they can with what kind of, they might have worries about it at school. So just the ability to do that skill is great. So I think exactly what Annie said, that validation and having that conversation is a great start.
All right, our next question is from Kathy Lynn at KOZY. If a child is having a hard time with a cloth face covering, is it okay to use a single layer cloth face covering? And I'm not sure if Kelly or Annie has additional information, but my understanding is there's still some determination going on about what is appropriate for a face covering. Kelly, do you have more information on that?
Sure. Yes, I do. A paper or disposable appropriate type of face covering. They can also wear scarves, bandanas, or, I mean, they include religious face coverings, but paper and disposable masks are appropriate types of face coverings.
Yeah, and I would add, definitely check with your individual school district, as they may have other dress code policies that will come into effect. That's the information we've received from the health department and working with all the districts. All right, Brett Scott, if a student forgets a mask at home for the day, will mask be provided upon arrival to school? Annie's nodding yes. Do you want to, and Kelly's nodding yes. Do you want to speak to that on what the schools are providing?
I can talk about distribution and what that looks like for school, but I'm sure Kelly's the health expert. So yes, if a child arrives at school and does not have a mask, there will be a mask for them. We need to make sure that that is happening to be in compliance with the rules at this point. We have to follow the rules. But I'm sure Kelly has more.
No, I'll reiterate, yes, what you said, Annie. They will be provided with one. The schools have an allowance and have used those to purchase mask quantities and other supplies. They should be prepared.
Yep. And I just want to add that following this, there will be a media release in written form that will have some more details about some of the mask drives and initiatives happening in Itasca County to support our schools. So there are initiatives, the Mask Up Itasca group, Elder Circle, and then from us at the Health Department and Emergency Operations Center, we also will have some supplies coming in that we can send to our schools. We're down to 1 more minute. Is there one last question before we end? Okay, thanks everybody. Stay well.